A very good afternoon, everyone. I am Dr. Shruti Bajaj, a consultant clinical geneticist from Mumbai. Today, we are going to try and understand the genetic aspects of this rare syndrome called as Angelman syndrome. What is the DNA? DNA is nothing but the storage of the blueprint of human information. Just the way a audio cassette has a tape on which the entire audio is wound and stored. In the same way, human beings have a highly coiled material of genetic information which is packed within each cell. This ball of genetic information is bound in the form of chromosomes and it contains units called as genes. And this thus DNA is nothing but the storehouse of genetic information within our bodies. If I was to use an example of this phone number, this is a perfect 10-digit phone number. If I delete certain digits from this number or I add unnecessary digits, it would result in an error in connection. In the same way, within our DNAs, if there is a part of the DNA which gets deleted or duplicated, this would result in signaling errors, and this could manifest as diseases externally. It is not necessary that every mutation, it is not necessary that every genetic error manifests itself externally, just the way sometimes adding digits in a particular phone number, like this, adding a zero before the phone number, may not necessarily result in an error in connecting. We need to realize that none of us are perfect. We are all carriers for around 5 to 8 mutations for autosomal recessive diseases. A carrier is an individual who carries the mutation but does not himself or herself manifest the disease. Depending on the mode of the inheritance, this carrier can pass on the disease to the next generation. Why and how do these errors or mutation occur in humans? So some of the mutations are inherited. We get them from our parents, either one of them or both of them. Whereas certain mutations occur de novo. It is not inherited from the parents. Occurring de novo means occurring on its own in nature. Before we proceed ahead, let us try and just refresh about certain basic concepts of Angelman syndrome. It is a rare disease with an overall incidence of 1 in 12,000 to 1 in 24,000. The main clinical features include developmental delays, seizures, sleep and gait disturbances, lack of speech, and behavioral concerns. Although notably, most of the children with Angelman syndrome will have a normal lifespan. If I was to systematically arrange the genetic material in our body, this systematic rearrangement is called as a karyotype. If the chromosomes in our body are arranged in a descending order, this is a pictorial depiction. The chromosomes are not present in this systematic format in our body. This is the computer depiction, a systematic depiction of the karyogram, where you can see 23 pairs of chromosomes. Chromosome number 1, 2, 3. All humans have 23 pairs of chromosome, and chromosome number 15 is important with regards to Angelman. Mutations in a particular region of the long arm of chromosome number 15 is responsible for Angelman syndrome. Of note, it is important to remember that majority of the genetic errors that cause Angelman syndrome occur de novo in nature. In other words, they occur on their own. There are very few cases which are inherited to the maternal lineage. This is an important concept to understand the genetics of Angelman syndrome. Out of the 100% of our genome, 85% of our genetic material is such that it is expressed equally from whether the genes have come from the father or from the mother. Whereas 15% of the genes are such that these genes will express themselves only if they have been inherited from a particular parent. So I will give an example in the next slide. This is called as genomic imprinting. Imprinting is nothing but silencing. Only one of our parents' genes are expressed in 15% of our genome, whereas the other parent's gene is imprinted or silenced. So if I was to see this part of the figure, here the mother's genes are silenced or imprinted, and so the progeny, the children, will inherit and manifest externally only this capital A gene copy. They will not manifest the small a gene copy. This is maternal imprinting. Now, what is paternal imprinting? Paternal silencing. So when the father's genes are silenced, this phenomenon is known as paternal imprinting. And in this case, the mother's genes then express themselves. Why is this important? In individuals who do not have Angelman syndrome, it is the mother's genes which are expressed normally within a given region. So in the long arm of chromosome number 15, 15q region, there are certain genes which are expressed only when they are inherited from the mother, because the father's corresponding copy is silenced in that region. So understandably, if anything goes wrong in the mother's DNA, because that is the only functional copy in that Angelman syndrome critical region, then if anything goes wrong in the mother's copy, that would result in Angelman syndrome. So once again, this is a depiction where the father's gene is silenced in the Angelman syndrome region, whereas the mother's gene is expressing itself. Now, if this gene gets deleted, or if there is a mutation which occurs over here, or if the father's gene gets duplicated in this region, which is again futile because the father's gene is silenced, or for any reason, if even the mother's gene is silenced because of varied mechanisms, anything which results in non-functioning of the mother's important gene in this Angelman syndrome region will externally result in Angelman syndrome. One needs to understand that because there are different mechanisms for Angelman syndrome, understandably, there are different genetic tests which can help us to diagnose this condition. We need to appreciate that around 10% of the cases of Angelman syndrome will not be able to get a diagnosis despite the most sophisticated genetic test. Typically, the flowchart for diagnosis for Angelman starts by doing a blood test called as DNA methylation. This is a very useful test. It will pick up 80% of the patients with Angelman. However, once you get a positive Angelman syndrome diagnosis based on the methylation test, it is important you proceed further to understand what is the final genetic mechanism which has resulted in this condition. If the methylation is negative, 10% of the cases can get an answer by this particular test, which is UBE3A genetic testing, which is often achieved through next generation sequencing. Again, I would stress, we need to keep in mind that 10% of the cases will not get a diagnosis despite all the sophisticated tests that the child could be subjected to. This flowchart is also important for the parents to understand why on certain occasions your doctor may be asking you multiple tests. Sometimes if you get one test negative, you may have to dig further in order to reach a diagnosis. Depending on the regions where we stay, we often come across various myths surrounding the causation of Angelman. One needs to keep in mind that this is not a condition which is caused by any of the exposure to eclipse, particular foods in pregnancy, evil eye, any parent's fault, or depending on the socio-cultural background, there are individuals who feel it is a fruit of their previous birth. As a geneticist and someone offering genetic counseling, it is very important to patiently dispel the myths surrounding the causation of Angelman. You need to continuously reinforce that this is caused due to a genetic aberration, which most often than not has occurred de novo in nature. There are few which are inherited from the maternal lineage. Even these few conditions which are inherited from the mother are not due to any parent's fault or any parent's wrongdoing. And of course, we need to stress that there should be no room for guilt amongst the parents, which is often seen in families having individuals with genetic disorders. A positive emotion, a positive outlook towards these conditions often ends up fostering an even better bond between the parents, eventually resulting in better care of the individuals with Angelman syndrome. An important area, other than ordering the right genetic test, another important area where a geneticist can often be helpful to a family with Angelman syndrome is when they plan another baby. Before we embark on trying to explain what is the risk of recurrence in the next pregnancy, it is very important that we first arrive at a precise genetic causation in the child who has Angelman syndrome. In the absence of a precise genetic diagnosis in the affected child, we cannot, in a reliable manner, predict the risk of recurrence in the next pregnancy. So, if there is a family who has a child with Angelman syndrome, but the genetic tests have returned negative, normal, inconclusive, in such a case, we really cannot predict the risk of recurrence. Is it truly an Angelman syndrome or any other disorder? Or is it one of the Angelman syndrome, the 10% pocket, which does not get picked up by genetic testing? If you do not have the error in the index case, we don't have the targeted mutation which we are going to test in the incoming baby. Most of the Angelman syndrome are non-inherited, de novo. And it is optimistic to note that in these cases, the risk of recurrence is less than 1%. There are few causes of inherited Angelman where the risk of recurrence can be substantial, going to the tone of 50%. It is very important that all these matters are sorted out and a thorough genetic counseling is sought ideally prior to the conception, which the family is planning, prior to the conception of the next baby. Once one has found, it is very important again that you first have to be sure of the genetic diagnosis in the affected child. Once that is established, we can then draw out material from the womb, either the placental tissue at 11 to 13 weeks or the amniotic fluid at 16 weeks of gestation through amniocentesis. From this, the fetal DNA is extracted, and this fetal DNA is subjected to genetic testing to know whether the baby inside the womb is affected with Angelman syndrome or not affected. In regards to Angelman syndrome, if you plan to do the methylation test on the fetal DNA, it is noteworthy that the amniocentesis is a better test as compared to chorion villus sampling. Finally, I would like to say that there are certain rays of hope across the horizon for Angelman syndrome. A variety of agents are being tested through various clinical trials. Although it's too early to celebrate, but we can definitely look forward towards some positive breakthrough in the years to come. These are few interesting literature for those who would want to browse through the same. I would want to summarize by saying that Angelman syndrome is a rare disease caused due to an error in chromosome number 15 region. Remember, there are different genetic mechanisms causing this condition. Most of them occur on their own in nature. And for these category, the risk of recurrence is less than 1%. Please refrain from guilt, blame, or negative emotions regarding the causation of Angelman syndrome. Remember, there are different genetic tests which can help your doctor to establish the diagnosis. Do cooperate with your physician. Important to get a genetic diagnosis to plan not just the future pregnancy, but also the surveillance and prognostication of your child having the disease. Remember, 10% of all Angelman syndrome may not get a diagnosis despite the best efforts, and it is possible to prevent a recurrence in the next pregnancy in liaison with a good genetic expert or a genetic counselor. I always believe that with the right attitude and the right multidisciplinary care, we can overcome the challenges of any condition, and together it is possible to offer a better tomorrow to our children. I would be very happy to take any questions or any queries or any suggestions for improvement towards this talk on any of these contact details. Thank you so much.